Hi, today we gonna talk about some liver diseases and definitions. Starting with liver cirrhosis. That is a chronic liver disease, characterized by fibrosis and nodular regeneration, resulting from injury, by viruses or alcohol or any other reasons. These injuries lead to fibrosis and nodules, that may block the blood flow, and finally lead to irreversible loss of normal architecture of the liver. And causes of liver cirrhosis are alcohol, chronic hepatitis, infection as viruses or parasites or bacteria, severe malnutrition, hemochromatosis or hepatolenticular degeneration, and we gonna talk about them later, and alpha-1 antitrypsin deficiency, and some drugs. The patient with liver cirrhosis may come asymptomatic, or could come with firm and sharp border liver, enlarged first then shrunken. Liver cirrhosis may complicate to liver cell failure, or portal hypertension, or hepatoma. And that was liver cirrhosis. Now we gonna talk about hemochromatosis, that called also bronzed diabetes, due to the patient appears bronzed color skin, and the most sensitive organ is the pancreas. Hemochromatosis is hereditary disease, characterized by excessive absorption of iron, that will lead to increased total body iron, so it will deposit in many organs, one of them is the liver. So the complications are liver cirrhosis, cardiomyopathy, arrhythmia, diabetes mellitus, bronzed color skin, arthritis, testicular atrophy, mental disturbance or pituitary dysfunction. Hepatolenticular degeneration, also called Wilson disease, is abnormal copper accumulation in the body, not by increased the absorption, but by deficiency in hepatic formation of ceruloplasmin, that is the principal transport protein for copper, so increased free copper, that will deposit in many organs too. Liver cell failure. Liver cell failure, caused by infection, or alcohol, or autoimmune disease, or terminal stage of liver cirrhosis, or malignancy, or hyperthermia, or obstructive jaundice, or Budd-Chiari syndrome. In liver cell failure happens, marked hypoalbuminemia, portal hypertension, and increased the aldosterone level. The patient mostly come with fever, fatigue, anorexia, loss of weight, jaundice, encephalopathy, pewter hepaticus, skin manifestations as spider nevi and purpura. Hepatic encephalopathy. Hepatic encephalopathy is a neuropsychiatric syndrome, seen in the patient with acute or chronic liver cell failure, or with portosystemic shunt. There is increase in ammonia, and there is production of toxic substances, by the bacteria in intestinal protein, and there is hypokalemia, so decreased glucose entry to cerebral cell, there increase in permeability of blood-brain barrier to some of toxic substances. Normally the ammonia is detoxified by the liver to urea, but there is liver cell failure, so hyperammonemia leading to encephalopathy. The portosystemic shunt also increase the ammonia in the circulation. The ammonia when cross the blood-brain barrier, happens metabolization to it, by the astrocyte cells, leading to brain edema. There are grades of hepatic encephalopathy, according to symptoms, so grade 1 when there lack of concentration or awareness, euphoria or depression, inverted sleep rhythm. Grade 2 when apathy or slurred speech, disorientation for time, and marked asterixis. Grade 3 when look sleepy or amnesia, or incomprehensible speech. And grade 4 when there a coma. Portal hypertension. Portal hypertension is elevation of portal vein pressure. The most common cause is liver cirrhosis, but could be cardiac cirrhosis, or bilharziosis, or veno-occlusive disease, or portal vein thrombosis, or Budd-Chiari syndrome. Symptoms are splenomegaly and congestion, and intestinal congestion, leading to distension, and dyspepsia. Firm liver with sharp border, and ascites, and encephalopathy, and esophageal varices if there is portal systemic shunt. Esophageal varices is when dilated, elongated, tortuous veins, in lower end of esophagus, and when it rupture, happens hematemesis. Budd-Chiari syndrome. Budd-Chiari syndrome is obstruction of large hepatic veins, due to thrombosis, or compression. The patient comes with acute abdominal pain, and ascites, and rapidly enlarged tender liver, and maybe their lower limb edema, if prolonged, and visible dilated vein of abdomen. Thank you for listening. That was all today. I hope you learned something. Thanks again and subscribe for more.